Hey guys, welcome back to this video. So I'm back again with another part of nursing job interview questions, but this time these interview questions will be like more applicable for someone who got a bit of experience working as a nurse back home or even in UK. And these interview questions are provided by one of my like sister, not sister, I know her from TikTok as well, so Auntie got a job as well. But in this video I'm not gonna be sharing about answers, and I will share some like tips and tricks, but not made up answers. So yeah, but if you are new and if you are newly qualified or you haven't got any experience as a nurse, then I've made a video, previous video, it's in YouTube, so you can like in there I've covered answers as well, so you can definitely go and check those answers, and even you are like free to make your own answers as well. So yeah, like other interview questions, the first interview question is tell me about yourself. So in this question you can just generally state like what do you do generally. Like if you got experience, then they want to know about your like what sort of experience as a nurse you got. Like you can say you were working in that ward since that and all that information. Okay, so yeah. Hey guys, so the second question is tell me about your experience. So in this question you can answer like like which ward you were in, but be mindful not to include that ward. Just tell about like where are you working, like which like acute care or community care, or working as an agency nurse, and what sort of skills you like you were doing on your daily basis as a nurse. So and since when you started working as a nurse, how many years of experience you got. So these all are the like answers you can give in this question. And guys, another question was like what are the values of your trust or the trust you are working for or you want to work, and what do you think you can improve from that value. So guys, please you need to know what are the values of that trust you're working for or you want to work, and like what made you to choose that specific word or the trust. So you need to know what are the values. So for example, one of your trust values might be putting patient first, so you can say I quite like the values this trust like this trust carries, or this trust is working for, is that fact that this trust is prioritizing patient first, and that is something which attracted me towards this word as well, or the trust as well. And I think even my small effort toward like prioritizing patients while making every clinical decision and taking consent every time while doing like any simple to complex nursing interventions, and centralizing patients while making any clinical decision and respecting their choices even though they want to like refuse any treatment or care, might might improve trust values, and might like take might be the one small step towards like improving the trust value. So guys, they might also ask about how you gonna work while like being so as a staff. Then you need to know like how you can like work. So what is your time management skill? So I can always say like there have been a size of staff while on shift, but during my university time I had to work, like I had to do my assignment work and so many things on background as well. So from there I learned about time management skills. So I believe if someone got time management skills, even though we are busy, we can manage our work so that you don't like no one falls behind. And on top of that, I think we need to work as a team as well. So if someone needs a hand in doing something, we can always help. And with the time management and good teamwork together with good communication skills between the team, I think we can like manage that shortage of staff shift as well. So yeah. So the patient is like patient was supposed to get 2 units of insulin, but you found out that the patient is taking 24 units of insulin. So in that situation, what would you do? So in that condition, what you can do is you need to stop any infusion as soon as possible, and then check the blood sugar of patient on regular basis until stable. Stable means 4 to 7 mmol per L, and you need to escalate that one to doctors. You need to give carbohydrate rich food to the patient, any fizzy drinks, and because that's a human error, you need to detox that as well, and you need to inform patients next of kin that this sort of thing happened, and you need to tell your ward manager as well. So another question can be like, how do you manage or how do you work with difficult patients? So in this type of question, you can say, I will try to listen what patient is trying to say, but sometimes when patient is in pain and they might refuse any any interventions, then in there you can listen what patient is trying to say. So listening skills together with good communication skills blended with empathy, I think we can manage even difficult situations. So first and first, we need to listen what patient is trying to say. Sometimes we may think patient is difficult, but actually we're not understanding what the patient is trying to say. So I believe if we got good listening skills, communication skills, and if we are empathetic, then I think we can manage, or we can work with that situation. Yeah. So other question might be, what soft skills or experience you can bring from your current job role to this job role, and that one you can say you got good communication skills, you're a good listener, you're a good team worker, and also like you got or you can say I'm good in certain skills like venipuncture, catheterization, cannulation, doing ECGs, blood scanning. Those are also of skills. I know they are very important in this role, and I think with that role that is definitely that's coming with me. Or guys, in every job role there will be a question called what are your strengths and weaknesses. So in this strength you can say you got good communication skills, you're a good listener, you're a good team worker, and you're like weakness, you can say like, oh, I'm a bit emotional kind of person. Sometimes it's hard for me to see patient suffering, and I find like a bit difficult to handle that situation. So I think that is weakness. So yeah. Hi guys, for sure there will be a question based on safeguarding. So they might say, if someone appears like bruises everywhere, then what sort of like steps you're gonna take. So in that condition you need to ask patient, or if they're able to communicate, or like how that bruises happen. It might be because of fall, and if you don't ask patient, you might like cause unnecessary escalation, which was not necessary as well. So in that condition you need to ask patient. If that is unexplained, then you need to escalate. You need to write so what your concerns are in your nursing notes, and so that you're concerned about their care. And also you need to escalate that one to your senior nurses, ward manager, and after discussing they will and you need to engage the safeguarding team from your ward or hospital as well. So yeah.